So now the ventricular depolarization. First is your septal depolarization. So we all know that in the septum, from the left to the right, initially the left bundle branch will be stimulated, electrically active, then it will stimulate the right part. So from the left to the right and upper part, so the direction of the vector will be upward and to the right, upward and to the right, because from the left side, at the left part, first electrical signal will go, then it will go and depolarize the right side. So the direction is upward and to the right, and it is a thin part of myocardium, so the volume will be small, and as it does not now when the electrical signal has reached the ventricle, so it has got specialized type of conductive tissue, so it is always fast. So the first is a ventricular depolarization, which can be divided into three terms. One is the septal, another is the major ventricular, and the basal depolarization. What is the direction, value, and the speed of this septal depolarization? It is directed upward and to the right. Amount is small and it is fast. Now come to the second is the major ventricular depolarization. So major ventricular depolarization is something, so you will see that suppose we are having ventricular depolarization like this, and you will see that suppose this is the ventricle, so there are some layers of cells in the ventricle. Some cells, they are nearer to the cavity, just beneath the endocardium. So these cells are known as the subendocardian cells. Okay. Whereas few cells, which are at the corner, they are known as subpericardial cells. So which one do you think they will be depolarized first? It is the subendothelial cells which will be depolarized first, followed by the depolarization of this subpericardial cells. Okay. So in this way, the depolarization wave in this direction, it will move. In case of right heart, it will move in this direction. But as we all know, the thickness, so we can say it will have the thick left ventricular depolarization wave. It will have thin right ventricular depolarization wave, and when all these waves are summated, you will see that the thick left ventricle will get the priority. Okay, so we know that in the previous slides I told you that the thickness of myocardium, it affects. So if the myocardium, it is thicker, that means the force will be more. Okay, the force is more, and when thin and thick they are compared, so the more predominant will be the thick one. So in this case also, the thicker left ventricular will take the upper hand. So the direction of the vector, so as it is moving in this way, so direction of the vector will be, that is, downward and to the left. So its direction will be downward and to the left. As the thicker myocardial tissue, it is predominant, so it will be a large vector, and all of these, they have a specialized conductive tissue, so the speed will be very fast. So the electrical activity when it is septal depolarization, when we translate it into cardiac vector, the direction of vector will be rightward, upward and to the right. So the septal depolarization, the direction of the vector is upward and to the right. It is upward and to the right. So it is A. B is the ventricular depolarization. Here we can say the direction is downward and to the left, and it has large vector and it is very fast. Okay, now come to the third part, that is your depolarization of the basal part of the ventricle, that is basal depolarization. So basal depolarization means, so now this wave will move in this direction. It will move in this direction. So when all these movement will be added up, so direction of this vector will be upward and to the left. So in this case, the direction is upward and to the left. It is upward and left. So in the basal part, as the amount of tissue is less, so it will be a small vector, and the velocity or speed will be fast. So these are the four things, three translation of the three part of the ventricular depolarization. So first electrical activity is the atrial depolarization. The vector is this. Second electrical activity is stimulation of AV node. The vector is this. The ventricular depolarization, we can divide it into three terms. One is the septal, the major ventricular, and basal depolarization. Each of them, they will have a specific cardiac vector. They have a specific value and the direction and the velocity. Now it is time to know how the ECG will read or recognize these vectors. We know from our previous classes. So ECG, it is acting as a galvanometer, and what were the basic principles we came to know. So when there is no current movement at the resting state, there will be no deflection. Second, when the positively charged current is moving toward a positively charged electrode, the deflection will be positive. When the thickness is more, so deflection will be more. When a positively charged electrical wave, it is moving away from positive electrode, the deflection will be negative deflection. Okay, and if a negatively charged electrical wave, it is moving towards the negatively charged electrode, then again the deflection will be positive. Okay, now all of these vectors, they have a specific direction, speed and value. So how our ECG is going to record this, that with that conception will give us an idea of the ECG pattern, or the pattern of ECG that we see.